Okay, we have the beautiful Dallas here today who gets to not be a nurse but gets to be a patient. And Dallas is going to get some neurotoxin. So go ahead and make some really pretty frowns for me. Look at that. So we have this is the most commonly treated area. This is called the glabella, everybody. We have the procerus muscle here in the middle, and then we have our corrugators here on the outside. Go ahead and lift up your eyebrows. So she really wants no movement in her forehead. Go ahead and relax for a second. So typically what we'll see in a lot of patients is etched lines right here in the forehead that are visible at rest, but Dallas is of course incredibly young and youthful and beautiful and may still have a little bit of neurotoxin left over that is keeping her forehead pretty smooth, but she told me she does not want it to move. So go ahead and lift up your eyebrows. So you see how she is able to move up her frontalis muscle a little bit. Now she doesn't have a ton of real estate here, so I have to be cautious of that. I can't give her too much up in here because I don't want to drop her brow. And then she asked me for a little bit of a brow lift. So we're gonna try and pop the corner of her eyes up a little bit. I've been doing this for like 15 years or so, and it's been working really well. That if you actually stop this depressor muscle from working, then the frontalis muscle can lift it up. But it does that only if you avoid injecting laterally here on the frontalis. So we have to be cautious with that. We have to look at everybody uniquely because everybody's anatomy is a little bit different. So we're gonna go ahead and clean her off. The other thing that Dallas asked me to do is apparently she's a tooth grinder. She likes to grind her teeth. So look at my fingers moving. Do you see that, guys? When she clenches her teeth, it's pretty pronounced. So she told me that she would like it in her masseter, and I kind of looked at her funny, and then I put my fingers on her. I'm like, well, dang, girl, I think you might actually be right. So let's go ahead and treat that as well. So we're getting her nice and clean. And then I have my neurotoxin. We're gonna use Daxxify today. So I have it all ready to go. Okay, so we're gonna go ahead and inject away. These are little itty bitty injections, so hopefully they're not too terrible for her. And go ahead and get in here. Beautiful. Frown for me and relax. Frown and relax. So when I do this, I try and avoid obvious vessels that might be present. Okay, so let's go ahead, lift up eyebrows and relax. So we're gonna try and get this guy to be a little quiet. And we'll go on this side too. That should pop her up a little bit. Now, I did promise that I was gonna do a little bit in her forehead. Lift up forehead. All right, my sweet. Let's do up in here. Let's do up in here. All right, one more time. Lift up and relax. Good. I don't want to do too much. I have a little smidge left, so I'll just give her a little bit on each side and we'll call it a day. The nice thing about Dallas is she works here, so if we need to give her a little touch more, we certainly can. Okay, good girl. All right, so now we're gonna do the masseter, which is super fun.
I don't know why my eyes are watering.
Well, because I've been stabbing you with needles, I don't know.
Yeah, it could be.
Okay. All right, so what I'm gonna do is I'm gonna put my fingers on her and I'm gonna have her clench. And we can see the bulk of this muscle. It's nice and bulbous here, and it's actually moving my fingers. Go ahead and clench for me. Okay, and relax. So what I'm gonna do is I'm gonna go in, and I'm pushing pretty hard, guys. And then I go just about a centimeter anterior of that, and I'm pushing pretty hard. Good. Nice. And then we'll do the other side. Have you ever had this done before? Oh, so the first timer, okay. All right, do it one more time. Good, and relax. We're gonna go in, and then about a centimeter forward. Yep, I got you, girlfriend. Good.
Perfect.
Good. So that should kick in pretty quickly. We're finding that Daxxify is working pretty fast. We've been really happy with it. And then what I do is I usually put a little bit of arnica on those needle spots just to prevent any kind of bruising. And then what's the rule for after neurotoxin, Dallas? What do we tell our patients?
I'm gonna stay upright for 4 hours
Yes.
at least. No physical activity
Until tomorrow.
until tomorrow.
Yeah, it's really deactivated and pretty much out of our systems pretty quickly. But I will tell you that this protein that Daxxify is bound to is pretty sticky. It's very, very positively charged, and we do think that there is some potential for continued recruitment of nerve terminals in the muscle. So what we find is that sometimes there's almost an immediate effect, and then after a couple days it almost seems like it is a little stronger. So, but we've been very happy with our Daxxify.
Thank
All right,
you.
gorgeous. You're all set.
Bye.
Till next time.